Let's welcome Ranga Shetty, CTO at Tune ABI Healthcare, to speak on future of claims management. Ranga leads the product and engineering function at Attune ABI. He has 3 decades of work experience in the software industry in the US and India with stints at Yahoo, HP, Intuit M LTSource and Cabletron. His qualification includes Master degree in Engineering Management from Stanford University and Master degree in Electrical Engineering from Rensselaer.
Hi, my name is Ranga Shetty, and I'm a product mentor at ABI Health, healthcare technology startup. Thank you for the opportunity to share my views on the future of claim management. There's actually been a steady and consistent growth in health insurance coverage in India. This is driven by private health insurance players, as well as significant thrust by the government to push health insurance coverage across the country. All of this is good for the country and, of course, for its healthcare businesses, because it makes quality healthcare accessible and affordable to a very large segment of our population. However, it poses a significant challenge to a hospital's operation. By some estimates, in about 5 years, up to 70% of a hospital's business will be the credit business, meaning that there will be a significant time lag between service delivery and revenue realization for a very large portion of your business. This will require hospitals to scale up their claim management operations significantly as the insurance coverage grows. Not only that, it will also require hospitals to optimize their claim management operations if they have to maintain profitability when there is a significant time lag between the delivery of a patient's treatment and then the realization of the revenue against that. So let me present to you my view of what a well-designed claim management operation should look like. But before we do that, let's take a look at the current state of affairs. Claim management operations are typically divided between the insurance desk and the finance department at a hospital. The insurance desk at almost every hospital is a hub of frenzied activity, and it's often very chaotic. Patients and their family members are walking in to get their pre-auth requests submitted. The inbox of the desk staff is constantly pinging with incoming email from TPAs with queries and approvals, rejections, etc. that they need to act upon. They need to make phone calls to the doctors to collect information that is needed for filling into forms, etc. There are ward boys walking in and out carrying paperwork. The result of all of this chaos is a lot of errors frequently, and also missed information, missed documents, which lead to a lot of queries raised by TPAs and maybe even rejections. It's very hard to achieve patient satisfaction in an environment like this. Imagine what this will look like as the volume of your credit business grows year to year. Similarly, your finance department is also dealing with a whole bunch of issues like this. They have to collate supporting documents for each and every one of the cases. They have to track outstanding cases. They have to reconcile settlements against each claim. They also spend a lot of time tracking down problem cases, adjusting for disallowances, and chasing TPAs for overdue outstandings and so on. They just don't have the means or the time to gather organized data which is required for a proper understanding of your revenue cycles and for identifying opportunities for plugging revenue leakages. So in this scenario, let's look at what potentially an ideal claims management operations could look like. Let's start with your insurance desk. Imagine your insurance desk looks like a flight traffic control center at an airport. Imagine if your staff was able to monitor all of their cases on large displays and are able to track every case and highlight potential problems as they emerge, and therefore they'll be able to intervene even before it escalates. Imagine if they were to be notified when any case that requires an action is highlighted. An action such as responding to a query from a TPA or notifying a doctor when an approval is received for a pre-auth. They'll also be alerted when an SLA is missed by a TPA, so they can follow up with the TPA. most importantly, for orchestrating all of this activity, the data that is required is automatically available on the system. Imagine that, right? And how would that happen? That would happen with bots which interact with TPA portals, download the required information and update the system. Bots that would parse incoming emails from TPAs, extract meaningful information out of it and update the case accordingly. Data from your hospital HI system also automatically flowing into the system. So now your insurance desk, instead of spending all of their time keying in data into forms and composing emails and searching for information across documents, portals, emails, are instead overseeing automated activity. They're using their judgment to intervene as and when action is required. Wouldn't that be a wonderful scenario for your insurance desk? Similarly, what would the finance department look like? Again, they'll be presented with readily organized and collated information that is collated to by case. So every case would have its relevant information in one place. For example, imagine the screen where on one side you see claim data submitted by the insurance desk and approved by the TPA. On the other side, you see data from your financial system regarding payments that have been received against that case. With these two sets of information side by side, your finance executive can make quick decisions on adjustments for disallowances, if any, and reconcile and close the case within a few minutes with just a click of a button. They can also quickly generate reports on outstandings for each TPA, and at the click of a button, send out reminders with detailed listings of outstanding cases to each TPA. Finally, they can spend more time reviewing reports and presenting their financial analysis of the state of your credit business to executive management. For example, they could tell you how much business each insurer is bringing in, as shown in this report. And they could tell you which payer has a lot of outstandings and even tell you what the age of those outstandings are. They can tell you what are the causes of most of the queries from the TPAs that result in delays in your claim, or the causes of disallowance that is resulting in lost revenue for the hospital. All of this rich information can give you insights that you can use to optimize your claim management operations. If you'd like to see a glimpse of what this future of claim management can look like, I urge you to take a look at this video that I'm going to play right now.
The process of effective revenue cycle management, or RCM, is crucial to the smooth functioning of any hospital. Yet most healthcare providers continue to struggle with manual processes in their RCM, resulting in challenges like long delays in settlements, loss of receivables, and even poor patient experience. With the wide adoption of health insurance and cashless treatment options, insurance claims management today forms an important part of revenue cycle management for a hospital. That's why today, most hospitals have a dedicated health insurance desk to manage the whole insurance claims process, patient registration, follow-up with multiple third-party administrators or TPAs through multiple portals, collection of claim settlement amounts. It is no surprise that manual intervention is time-consuming and subject to errors, but this doesn't have to be the case. Say hello to ClaimBook by ABI Health, a powerful RCM solution which is equipped with functionalities to address every stage of the revenue cycle and the insurance claims process. From insurance desk management, pre-authorization, and claims submission to query management and settlement of collections, ClaimBook can keep your revenue cycle moving in the right direction with its range of powerful features. A rules-driven data and validation engine ensures an error-free experience that is proven to improve TATs. ABI Health's proprietary auto-parsing technology reads uploaded documents and information from the hospital information system, eliminating manual entry and human error. The pre-authorization module provides a completely paperless solution to submit, manage, and track healthcare pre-authorization. A virtual mailbox within the dashboard provisions sending, receiving, and forwarding of claim-related communications. Pop-up notifications ensure prompt and easy action on items needing attention and can be addressed with a single click. With intelligent parsing techniques, cases are automatically categorized into relevant folders, Claims amounts are automatically calculated and approved cases are moved to finance department to keep the revenue cycle progressing with minimal manual intervention. What's more, ClaimBook also simplifies claim enhancements through seamless addition of documents, revision of claim amounts, and more. Other features that make ClaimBook a great asset to your health insurance desk are tracking of couriers when physical documents are sent to TPA, tracking of fully paid, partially paid, and outstanding claims for easy reconciliation, and comprehensive reporting on case statuses, outstanding dues, TPA performance, and turnaround time. ClaimBook can also be linked to hospital display boards to provide patients and caregivers with real-time updates on their claim status. So if you are in charge of a mid-sized or large hospital and partner with 2 or more third-party administrators to process patient insurance claims, ClaimBook can help you accelerate the claims settlement process, minimize the need for manual processing, ensure a stress-free insurance desk, improve TPA accountability, reduce the number of disallowed claims, deliver a positive patient experience, and above all, prevent revenue leakage. The result? A more efficient revenue cycle that ensures enough working capital for the smooth functioning of your healthcare facility. Some of the most trusted names in the healthcare sector trust ABI Health's technology solutions to power efficiency, productivity, and decision-making. Here's what some of our valued customers had to say about their experience working with ABI. So what are you waiting for? Get in touch with us today to schedule a free demo.
So if this future is appealing to you, do contact ABI Health. We'll be happy to give you a demo of ClaimBook, the future of claim management.